All right, cool. So let's talk about specifically adjusting your patients for postpartum. So Harmon had a C-section 3 weeks ago, right?
3 weeks ago.
Right. So last week when you came in, we couldn't even lay you down.
Yeah.
So what do you feel in this week? Where's your ability this week to do stuff?
Definitely able to get on my tummy.
Okay, yeah. Awesome. So first thing we're going to do to evaluate whether it's safe to adjust Harmon and how to amend that or to alter that is to have her go on her back if you can. Is that something you can do? Cool. So I'm going to have you on your back very gently. The abs are... Now tell me how your abs are feeling.
So I don't use them.
Yeah.
Because I don't want to pop the stitches.
Yeah.
I'm scared of that.
Right. So that's good. So what would you do if a provider asked you to get on the table right now? What would you do? You're like,
so I'm not using. I mean, this is like soft, right? So I'm using my arms to get down.
Does that provide any stress on your belly?
No.
Okay, perfect.
This is
you
always
you don't want to hurt yourself. The other way she could do it is to sit. Let's try that for me. Have you up just for a second? Sit again for me. Mm-hmm. And then lay. What do you think about laying on your side and then bringing your legs up?
Actually.
Yeah. That's why I get paid the big bucks. No, bring your legs up and turn around. Yay! See, that's a modification.
That's how I get out of bed.
Yeah. So a lot of people, they try to do it the old way and then it doesn't work. So they're like, so as a provider, it's important to evaluate if it's safe because she had major abdominal surgery. And we talked about last week how everyone thinks that it's just like, oh, you're supposed to be the same that you were. So if I was doing an exam on Harmon, I would take this down, if that's okay. I'm not going to do that on video. And she's going to have a scar right here. So your scar is about where on here?
It's a little lower, yeah.
How's it feel?
It's like numb and...
Because they cut the nerves, they cut the muscles, right?
And then it's like sensitive because the nerves are starting to grow back and like waking up. So it's super sensitive when it's doing that. Yep. So it goes away.
Yes, it does go away eventually. Yeah. So as a provider, I would put gloves on and I would gap her skin just to see the progression of healing. Obviously, it's just not on the outside. It's also in the inside with the muscles of her uterus. So I'd sort of gap it. I'd also, as a provider, I'm not your primary provider, but I'd want to see in between your checks to see if it's infected or any of that. Have you had any redness or... weeping or like that. So that's another thing that you can be an asset to your patient. You can ask if they've been running any fevers to see if they have any infections. So the first thing I would do to assess this, if she can lay down, is to lay her down, assess the scar, see where it's at, to see how much I could get with being aggressive versus not being aggressive. And 3 weeks after, you're not going to want to be extremely aggressive in the stuff that you do. So in terms of doing that, there's things that you would not do with her, which is to do any aggressive stretching that we did while she was pregnant. That figure 4 thing might be a little bit challenging today. Remember when I brought your leg up, put it across?
It may.
So it would really fire that. So we really don't want to do that. We're sort of like, we would document in the notes that she's had a C-section and we're not going to do that at this time.